Numbers of COVID-19 patients is upsurging day by day in Deepu Medical College and Hospital. Dr. Sumitra Hagjer, principal of Deepu Medical College and Hospital, has preferred for complete lockdown initially for a week. Earlier, I have spoken to her and saying that as per viewing the situation, there is a need for a week lockdown. Till now, the hospital is not facing the shortage of oxygen, but the casual attitude of the people has made a lot of difficulties for the health workers in terms of preventing the virus. We have been seeing people coming out without the face mask and also going to the crowded places. This has, of course, made a trouble for the frontline workers. And if we look into the numbers of COVID-19 patients here in Karbi Anglong, it has increased to 585 till yesterday as we spoke to the microbiological department of the hospital as they have been doing the test. 85 new cases have been found positive this month, and they have confirmed that it is also expecting that still the positive cases is yet to come. Let's listen in what the health workers as well as the authority of the hospital had to say as we spoke to them earlier.
The COVID-19 situation here in this hospital.
Good morning. So today in Deepu Medical College, as of today, we are having a good number of patients. Earlier we had 18, below 20. Today on this at this time, at this hour, it is 35. Yes. So there are maximum number of patients need oxygen. Some are recovering. Every day 2-3 are getting discharged. Today we may see a number of 5 to 6 cases getting discharged, but equal number of patients are also coming in. So today the number stands at 35.
Still the positive cases are you receiving?
Yes, we are receiving. It's day and night patients are coming in.
Okay, my next question to you is, as the situation is getting worse and worse in the other states as well. So what is your preparation for this pandemic in your hospital?
So first of all, I have sent a circular to all the healthcare workers in Deepu Medical College to be mentally prepared, then to prevent themselves from getting infected by observing COVID protocol. So that is wearing a mask, hand hygiene, and hygiene in the entire hospital. Then I'm also asking the superintendent and the nursing in charge to get the whole hospital sanitized every alternate day, and COVID hospital, COVID ward, and the RAT center and the registration center, the emergency ward every day.
Ma'am, what is the most difficult thing that you are facing till now, from preventing the COVID-19 here in your hospital?
I would say the casual attitude of the people. Some are coming with, they don't wash their hands, they don't sanitize themselves, or they have their masks hanging by the ear or under the chin. So they have a feeling in their minds that they will not get infected. But we never know who is being positive and asymptomatic and in the process spreading it in society.
And do you think it will be a very dangerous things in the coming days if the people, are not coming to aware in this situation?
Yes, of course. If people are still not aware, are still not vigilant in their behavior, in their observing of COVID protocol, it might be a case of super spreader. But I have a feeling that we may be going through we are in the peak of the COVID-19, or maybe we are going to face the peak in the next coming few days.
The rise of the state of Mumbai and Delhi, these are the states who are facing the shortage of oxygen. So are you facing such problems till now?
Fortunately not. We are having oxygen is available at the moment, and we are having 2 plants, one liquid oxygen plant and the other is a generation plant. Now they are fully constructed, they have been installed, only they have to be functional. So the people, the laborers, they have come yesterday, they have started work. So in 2 to 3 days it will be functioning freely. So we will not have to buy cylinders. So we will be generating our own oxygen, hopefully from Monday next.
My last question to you is, as I just want to know your own opinion, I mean your personal opinion, as the district administrations has regulated now, and now the lockdown has now, changes many things. So do you want to see more changes in lockdown, as far as now it is started from 2 p.m. Okay, so what will be your suggestion now?
If I look at it from the disease point of view, or from the spread of the disease, of course I would like to say that we have to break the chain. That is a must. And for that, yes, I would prefer a complete lockdown.
You prefer a complete lockdown?
Yes, a complete lockdown, at least for a week initially. And then then the rest is is up to the district administration.
So you now preferring for a lockdown for a week?
Yes, initially, yes. Then if we see that the trend of patients coming in is lessening, that means it is working, then we can go for half a day or whatever. But of course, I don't want to spoil the finance of the poor person also. That also we must think. For that I'm a little, of course everyone is worried, the district administration also worried, so am I. But it cannot be helped. So I'm saying, from the point of the disease spread, this is what I want. Yes.
In your hospital as well as in the western part of Karbi Anglong, can you tell me the percentage as well as the numbers of the tests?
Here in Diffu Medical College, in Department of Microbiology, we are doing the RT-PCR test. So in the month of April, we tested around 4169, that is 4,169 samples. And out of that, we got 151 positive, that is around 3.6% positivity. And in the month of May, till yesterday, that is 5th of May, we tested around 1,040 samples, and of that we got around 85 positive cases. And this data is only for the RT-PCR test.
And what about the western part of Karbi Anglong? Do you have any information regarding the western part of Karbi Anglong?
Yes, from western part of Karbi Anglong also, we had tested quite a few number of samples, around 367 for these 2 months, and there also positive. We have got many positives.
So, do you think the number has increased from earlier from now?
Yeah, earlier not much. For January, February, March, we also tested the number of samples that came to us were also less, and from January till March we got only 5 positive cases.